There is a little bit of disturbance, I think.
Is it better now?
Yeah, yeah.
Okay. Cool. Okay, thank you. Thank you, Anita. Check. So, good evening to all the attendees. A very warm welcome to Manusmriti 2022. Manu, which means our beloved, referring to our beloved Manu sir, and a session conducted in memory of Dr. Manu VL Kothari. Dr. Manu VL Kothari was a learned scholar, most loved teacher by students, a medical philosopher, and author of many books translated in many languages and national and international like cancer, death, medical, etc. He was very closely associated with the institution till his last moment. He has been highly respected among students, teachers, medical fraternity, nationally and internationally. He was a friend, philosopher, and guide for all. Now, I'll present a short clip of Dr. Manu VL Kothari.
मरीज की मुस्कुराहटों पे हो निसार, मरीज का दर्द मिल सके तो ले उधार, मरीज के वास्ते हो तेरे दिल में प्यार, डॉक्टर इसी का नाम है। We doctors are expected to well dressed because we intimidate the patient. There is a conversation in New Journal of Medicine where a patient tells the doctor, "Doctor, I am afraid of you because you are too well dressed for me." So we are supposed to be voluntarily poor. माना डॉक्टर देखने में फकीर है, फिर भी यारो देख के वो अमीर है। माना डॉक्टर देखने में फकीर है, फिर भी यारो दिल के वो अमीर है। मिटे मरीज के लिए वो जिंदगी, करे मरीज के लिए वो बंदगी। किसी को हो न हो हमें है एतबार, डॉक्टर इसी का नाम है। A patient comes to us not by walking, not in car, not on cycle, but on a path of faith. A patient comes faith. Faith. रिश्ता है मरीज के एतबार का, जिंदा है तबीब से नाम प्यार का। You know one thing I tell you, somebody in distress, you look at the person as your own, and if love is dripping from your eyes, much of the patient's illness is likely to be mitigated. You must look at the patient. It's I who am suffering. It's I. It's incidentally. In fact, in Quran it is said that before a doctor goes to a patient, he must thank the God that but for your mathematics, I could be there and the patient could be here. Please remember. रिश्ता है मरीज के एतबार का, जिंदा है तबीब से नाम प्यार का कि मर के भी मरीज को याद आएंगे, मरीज की आंसुओं में मुस्कुराएंगे, कहेगा हर मरीज मरीज से बार बार डॉक्टर इसी का नाम है.
So now I would request Radhika to take over and continue.
Am I audible?
Radhika, it's breaking.
Am I audible?
It's breaking. Actually.
It's breaking. Wait. Am I audible now?
Yeah. Yes. It is audible.
Okay. Thank you, Rucha. It is a great honor to have with us our chairperson and ex-professor and head of Department of Neurosurgery, Dr. Sunil Pandya, sir. It would be a pleasure, sir, if you say a few words about Manu Kothari, sir.
I request.
Radhika, let's move on. Dr. Pandya can talk towards the end of the talk. He is not logged in. I don't know what's happening.
Okay, sir. We also have with us our founding president of Medical Humanities Society of India, who is currently working as honorary consultant in radiology at Kokilaben Hospital, Dr. Ravi Ramakantan, sir. I would like to request him to express his feelings and views.
Okay, good evening, everyone. I promise you one thing. This will be a really short presentation, less than half an hour. The Sunday evening is yours after that. How did it all start? I'm still not sharing slides, so don't worry. This happened about 3 weeks back. One evening, I get a phone call from, I use the word venerable for Lopa Mehta. Lopa Mehta calls me on the phone and she says, Ravi, you are talking in Manusmriti this year. I said, Lopa, when is it? She said some date. I said, well, what day is it? Sunday. I mean, I was trying to bat it off and she said, Ravi, I'm not asking you to talk. I am telling you to talk. And when Lopa Mehta tells you something, you simply follow. Because like many of those girls who have stayed in the ladies' hostel now, she's sort of a Hitler. You don't follow, you're in big trouble. So I was talking to some people, some girls there, and he said, I feel Lopa Mehta is a Hitler. Do you really think she's a Hitler? She says, Ravi sir, what are you saying? You are being unfair to her. She is so thick that she would put Hitler to shame. So, not only because of that, not because I'm so scared of Lopa Mehta. So I simply said, ma'am, oh, sorry, I didn't say ma'am. When you're 70 years old and another person is close to 100 years old, you simply say, Lopa, I will do it. So today is that day, 16th October, and I'll do two things here. The first part, which I feel is important, is to talk about what influence Dr. Kothari has had on my life and how it affects in general the patient care that we provide in, in all fields of medical science and very particularly in our alma mater, the one that we are so proud of. And I will share my screen, okay? Okay, so you can see this first slide, I assume you can see. And then this is very important. This is the one I talked to you about, LAM, Lupa A Meta. It's important because so much of what's going on now here, the fact that I'm here, the fact that so many other things around medical humanities happen in GS and KM is because of this frail old lady. Now she's going to slaughter me, but she appears to be a frail lady, not particularly old, but she is the moving spirit behind so many other things, and of course, medical humanities. I hope I have buttered her enough to move on with my talk. So, I did not tell this to her. When she said, Ravi, you are talking, so I am talking. My question to myself was, why me? And then I sat down, few deep breaths, thought. And then I said to myself, why not me? And this is a story of why not me and how one person can influence generations of others. I'm just one of them. There are thousands of students who have been taught by Dr. Kothari, and Dr. Kothari taught or teaches means something altogether different. So we have this inimitable, and I mean it, inimitable Dr. Manu Kothari. He would like to be called as M.V.L.K. That itself tells you what a different person he is. He wanted his mother's name in his initial. And here is an open challenge to anyone in the world. You look at that small clip that we saw at the beginning of this program. You show me one other teacher of medicine anywhere in the world, who can actually teach like that. This is not just a talk, this is teaching. He does this often during his anatomy lectures. So, what Manu Kothari was a man who was always in deep thought, always in deep thought. Sometimes eyes closed, often eyes open. And this image that I see here is something that reminds me of that poem by William Wordsworth, Daffodils. When oft and on my couch I lie, in vacant or in pensive mood, they flash upon the inward eye, the bliss of solitude. That's what Dr. Kothari reveled in when all his students and all his friends had gone away, head down, hands touching each other, thinking. MLK, as we all know him, we never called him Manu Kothari. Some of his close friends call him Manu Bhai. I've been asked by him to say Manu, but I could never do it. I will not do it because I cannot do it. So he thought differently. He thought differently. He taught differently. Everything about him was different. I'm sure when I talk about taught differently, many GSIs who have been subject to his anatomy classes in lecture number 2 or number 3 cannot forget the sweep of his apron when he talks of the peritoneum as something that protects everything inside the abdomen. That phenomenal sweep of the apron is still there in my mind after what, 40 years or something. The other thing about his lectures was fun. It was complete fun. Complete fun because in those 45 minutes, there was very little anatomy. Most of it was time pass, common knowledge, philosophy, what a doctor should be, so on and so forth. And it was a big contrast in my times to two other teachers who were there, very senior professors, K.D. Desai and S.M. Bhatnagar. They were very serious teachers. They taught anatomy. Dr. Kothari taught medicine to 18-year-olds. And then it happened that we go on like this, and this generation of GSI, unfortunately, will never have had a teacher like him. He was exceptional because even after he retired, he would continue to come to the hospital and think, research, train, and teach. So, as somebody said at the beginning, he was in KM, he was born in 1935. Most of his life, till the very last day, he spent at KM. He was always available for others to meet with him. There are many, many GSI who are faculty at that time have gone to him, sir, what do you think? Sir, what do you think? And the first among all of these is the neurosurgeon Atul Goyal. He will go and pick Dr. Kothari's brain about the craniovertebral region, about syringomyelia and stuff like that. And some of his ideas that he has published, Atul Goyal has published, have come out of the 1 billion, 100 billion neurons in Manu Kothari's brain. Now is the real story. When you enter GS Medical College and go to the second floor, there are many things that you see that you've never seen before in any college. There are posters and posters and posters which make even an 18-year-old think, all courtesy Manu Kothari. And some of you will recall that poster. Unfortunately, I don't have a picture of that. The old adage that dead men tell no tales does not hold true here. First day, first show, 1951, that's what struck me. I didn't know what this was about, but I have a vague idea it was something about death and how even dead men tell tales. We'll come to that a little later. So you have something like this learned man, that's the whole thing about MLK, and I admit him for that. Extremely widely read, phenomenal memory. He would say, Ravi, you know something, in chapter 13, verse 9 of the Bhagavad Gita, this is what Lord Krishna tells Arjuna. You go back and check, MLK is right. Page 113, second edition of the OED, Oxford English Dictionary. See the last entry, it is about empathy. You go and check, he is right. So this man has phenomenal memory, and I envied him not for his memory, for the width of his knowledge and the depth of his reading. And I always regretted that I was just the opposite. I was neither widely read nor deeply knowledgeable. So this is one example of how, I'm going to call it MLK, I can't call it any other way, change the facade of the college. We're talking of genius alone surviving death, and it's so true in the case of MLK. I told you, he thought differently, he talked differently, and he thought differently. He was, without question, a genius. That's 100 billion neurons in his brain may have been making 100 billion connections. And so it was natural that no one wanted his memory to be abolished after he passed away. And he always talked of death philosophically. Death is but one end of life. After birth, the only thing that is certain is death. And these are things that I often talk to friends about, and that also keeps on going in my mind. And I will talk to you a little bit about how those influences rub off on his students. So there you have a genius whose memory we didn't want to pass away. And therefore, we had this program, the only one in all of Bombay, the only department of medical humanities in all of Bombay. Of course, there are some others elsewhere, but this is the first and the only one in Bombay. And it was so apt that we renamed it as the Manu Kothari Department of Humanities. In fact, I had wanted that this should be called a Department of Medical Philosophy, but the consensus was that this was Medical Humanities. In fact, Department of Humanities. Now, who's going to run this show? The big question was, we formed a department, we can't leave it alone. And we are so fortunate that we have unbelievably enthusiastic Bachu log. Now, Bachu log means undergraduate students. You see three of them here. I'm not partial to boys, but these were hanging around them. I said, come stand, I'll take a picture. They couldn't say no, take informed consent, nothing of that. I just took their picture. The whole show of medical humanities in GS Medical College runs on the Gada Mazuri by resident doctors. I'm sorry, by undergraduate students. Like this program, like the history of medicine lecture. Who do you think is running around making those invitations, making those Zoom links, recording them? All that is being done by undergraduates. Throw back to 1973. I would not have done it even for an MBBS degree. It's a lot of work. But it's not just them. They would be undirected. The omnipresent, the venerable, you know who, Lopa Mehta, is behind them. And she's there in that room, which is locked now, almost always. Almost always. Even now, at whatever age that she is, I'm not letting it go. So she's the one who will see that this goes on. Now, I asked her, Lopa, you are not a permanent fixture on this earth. What happens after you? And she said something which was extremely gratifying. She said, Ravi, don't worry. There are other staff members who have taken over much of the work, and I'm not going to name them because I'm not sure I'll be naming all of them, but there are others, at least half a dozen other people who are standing shoulder to shoulder with Lopa and carrying on the work of medical humanities. Okay, humanities in medicine, incidentally, it's no longer called medical humanities, it is called health humanities in the GS Medical College. Where it will go, how far it will reach, depends not on those faculty as much as how much and how enthusiastic Bachu log are. So this is a fitting tribute. I think it's phenomenal that we have this tribute to him, and his name is permanently etched on the walls of the ground floor of the college building. I do not know how many GSites are listening to this. I do not know when you visited the college the last time, when you have nothing else to do, just for the heck of it. Go to the college on a working day, take a round of what's happening at the hospital and in the college. And then Shetty's canteen is always open for whatever you want. And if you have been popular with him, like I was in radiology, all that you do is go to the canteen and have cups of tea. And when I went to the canteen first time, post-retirement, he said, Ravi Saab, aapse kya paisa lega? So all of that stuff from the canteen comes more or less fukatka for me. I'm not sure that will happen for you. Levity aside, the reason I implore you to go to the hospital and the college is because that's your alma mater. Whatever you are doing is because they existed. And soon we'll be celebrating the centenary of our institution. That cannot be a bigger event than that in your lifetime. We do not know what those visits will do to you. We do not know how you'd be morphed into participating in those centenary celebrations. Alumni make an institution. Students and faculty run the institution. That's a beautiful phrase or word or line or whatever it is in one of our dean's lines on the internet, on the web page. She wrote something very profound. good traditions are difficult to achieve and harder still to maintain. Dr. Pandya talked about the traditions of our institution, such a moving speech. And I'm so happy that there are so many students listening to that talk. So it's in our hands and your hand, the generation that is there, to maintain those traditions and see that the dreams of forefathers are continued at a greater level. No, that's not the end of the talk. I mean, a lot to go. So this was just off. I mean, I'm not prepared to talk. I'm just talking. Those who know me know that I talk. Anyway, so this is a landmark achievement for the institution, and what will it do? The big question is, what is the purpose of these departments of health humanities, or whatever you want to call it? What goes on, and I'm sure many of you who are past GSIs have not seen this. What Dr. Kothari, I'm sorry, what MLK has done, I don't want to be formal, I want to be myself here. What MLK has done to many of us who have been like furniture in the GS Medical College. Those of you who do not know me, I joined as an undergraduate student in 1971 and I retired as a radiologist in 2010. 40 years, every single day, every stone, every dog, every cat knows me and I know them by name. So when you are in the hospital like that, you start noticing everything. How is this place different? You see these boards on the second floor that I told you about death and dying, about genius, and then you walk down, you suddenly find one day that there is this tube board called Janus. And I know that Dr. Kothari will ask you, Are Ravi, you saw that board? I have to say I saw it. And then he's going to ask me, what is this? Now, I'll tell you what happens when he asks you, what is this? So by that time, I had known what this was. And can anyone of you, in your own mind, guess what this represents? I'll give you 10 seconds. Think. Close your eyes if you want and think. Why is this name, Janus, on top of this beautiful arch? And if you are in a radiology class, I will ask you what is a keystone anyway. So this arch is what symbolizes the Indo-Saracenic type of construction that you'll see in the whole of our college, hospital, the GPO, the Gateway of India, and the Prince of Wales Museum, all by George Whitted. More history for you there. So the word Janus represents a Roman god, and that god had the power to look back, look forward, in the future, in the past. And this is the name that we have for the archives of the GS Medical College that have been, what should we say? What is the right word? Curated. Yeah, that's the word. Curated by three people, initially by Dr. Kothari, Dr. Lopa Mehta, and the unimitable Dr. Sunil Pandya. He is obsessed with history. So he gets after everybody to get records, and this is the entrance to the pathology museum. Yeah. On the right, there is a door, and that door leads to a long, very long rectangular room, which houses many archives. And Lopa is now looking after it like he does look after so many things and collecting archives. So if any of you has a piece of the history of GS Medical College, any record, any paper, any object that you stole from the library, for example, you can meet Dr. Lopa Mehta on the ground floor opposite the old PG library and hand it over to her. And she's Dr. Lopa Mehta at gmail.com, the one and only Dr. Lopa Mehta. Anyway, so this is something unique. You can know I called it archives. He didn't call it archives. He called it Janus. I told you he thought differently. So when you have an atmosphere, students come to the ladies' common room here. You know where the ladies' common room, all boys know where the ladies' common room is. So they walk past this room, turn right towards the canteen. They see this. They start thinking. An atmosphere of great learning, an atmosphere of think, thing, an atmosphere of being different. Not just this. You walk to the right and then you have the new library building on the ground floor. And this is something that struck me long ago. My love life, if you want to call it that, with Sir William Osler started with this board. And I said, who is this man? And then you know that Sir William Osler is what he is. I'll be talking on him in one of those lectures a little later. I mean, this is a commercial for that lecture. So you come to this and you see something like this. So this is also everything that is slightly off track is also of this man we call as MLK. These are profound sayings. Even as an undergraduate, you can read it. You may not understand all of it. You may not appreciate all of it. You are obsessed with pharmacology side effects. You're obsessed with MCQs. You're obsessed with the PG entrance test. But you have read this. Somewhere, something will make a connection sometime. And you go on like this, on and on. MLK has his footprints on the sands of time, as if it is on the sands of time. Now, this is the fully renovated casualty section. For those of you who are GSites in ancient history and are still listening, this is something that happened in 2000, something like that, when I was still there. A benefactor whose name is there on that board there, and he doesn't like his name shown, so I sort of blurred it off, donated lots of crores of rupees to revamp the EMS completely. I'm sorry, the OPDs completely. And then we had the emergency medical services, the concept of casualty becoming emergency medical services. Granted, Dr. Kothari had very little to do with it, except that above this board that you see there, there was some extremely profound lighting. I think that's gone now, but this is what it said. How much more appropriate can it get to a person who has had a broken limb, a burst abdomen, a cardiac arrest, when he comes like this? Granted, this is in English. Granted that many of our patients can't read, but this conveys the philosophy of this place. I had thought with my vast reading that this was by Dr. Kothari himself, and I learned later on that this is by, I learned it yesterday from Lopameta, that this is by Albert Schweitzer. Look at this man's talk. You saw that video. He talks of kindness, kindness, kindness. He talks of doctor-patient relationship through a Hindi movie song. And he puts up this board. So what we have to do, Lopa, what we have to do if Dean is listening to this, is to get this thing up there again. And if he can, translate this into Marathi. We have to be realistic. Our patients can't read English. So if we can translate it, Padmaja, if you're listening, Lopa, if you're listening, the Dean, if you're listening, let's get this back up there. It's important. It's a piece of our life. It's a piece of our casualty history, and we should get it back. I mean, I never thought of it this way, but when I prepare these lectures, these things come back rushing into my mind. And I said, this is a part of the glory of the casualty of GS Medical College. Human kindness. That's what we are talking about here. Human kindness. The man behind human kindness in GS Medical College well before departments of medical humanities ever existed anywhere in the country. How I come to the second part, MLK and Ravi Ramakantan. So I do not recall how and when this happened, but it has been going on for a long time. That we would go, many of us would do that off and on to the second floor anatomy department to the corner room, which is beyond the back of it, nowhere. If you want to jump down, you can jump down from that room. It's close to the dean's lawn where he sits there. So some of us would go there, but when you're in radiology and when you're Ravi Ramakantan, you have this completely perfected knack of being gainfully employed and still do no work. Ask my radiology resident, they would say 100% right. So I had a lot of time on my hand, and somehow, unfortunately, I don't recall. Somehow it started that post late mornings, early afternoons, I would climb up 2 stairs from the second ground floor of the ground floor of the hospital building, the so-called number 10, run up the stairs and go to that last room, close to the anatomy museum. And Dr. Kothari would be sitting there. Often Lopa Mehta is sitting there, but my conversations were always with Manu Kothari, hardly with Lopa Mehta. Lopa Mehta is reading a book. I realized that she was reading the book, but pretending to read a book. Because I'm talking to Manu Kothari for 1 hour, Lopa Mehta is looking at the book and no page is turned. Lopa, you have to be more careful next time. But jokes apart, all this conversation that we had was with that man whom we talked about. And all of his thinking, all of his philosophy has, in a sense, rubbed off on me. And I'm sure it has happened with a large number of other senior, I wouldn't say senior, postgraduate students who visit his department off and on with personal or other problems. Therefore, we have a story here. One reason I would go there was simple. You go there, he would look at me, pick up the phone and say, "Canteen, Ravi Saab ka chai." Now there's a lot of politics with Ravi Saab ka chai, and I won't go into that. But that chai is something I couldn't resist, so we'll have tea. He will have nothing, maybe a glass of water, and we will talk. Now sometimes it does happen. This, I'm not able to go up. So he could have called me up and said, "Ravi, you're not from no." He would pick up the phone, call me up and say, "Ravi, no darshan." And once I got brainwave, I said, "Sir, today is a cloudy day." "Arey wah," he said. So Ravi no darshan would mean that I'm supposed to climb up 2 floors and go and sit with him and talk. Now, first time, and I'm reasonably sure that I'm telling the truth, the first time I heard the word empathy was from him, maybe 10, 15, 20 years back. I don't remember. Yeah, it must be 20 years back. Empathy. So he asked, "Ravi, do you know the meaning of the word empathy?" I bluff something. I have this habit of bluffing. Now I realize it's not a good habit. I tell my bachu log, if you don't know, tell I don't know. That's fine. But I was otherwise. So he is Manu Kothari. He doesn't give the meaning. He said, "Ravi, wait. I will take out the dictionary." Many of you are used to it. So he pulls out one book. He knows where the dictionary is. He pulls out that book, and there is Collins English Language Dictionary. He reads the meaning of that. Wait. Oxford, concise Oxford Dictionary. Wait. Oxford Dictionary, unabridged, revised, enlarged. So he takes up 3 dictionaries for me to understand the meaning of the word empathy. That's Manu Kothari, a word master, a man who could remember words backwards, a man who could pun like crazy. So I had to tell him, "Sir, your quota is over. 3 puns per conversation." By the way, do you all know that punning is a male brain thing? Keep watching. Women rarely pun. And it's something to do with our biologically different brains. But Manu Kothari was a pun master. It's not as if I got all his puns easily, but he would pun. So he explained to me the meaning of the word empathy, and I realized it was very different from what I had thought. I knew that it was not sympathy, but I didn't know the depth of the meaning of the word empathy. So it started like this, one word at a time, one thought at a time, and then a philosophy of medical care, which I feel is something that has come to me from him, perhaps more than anybody else. Just conversation day after day with that great mind, which would sometimes it will continue for days on end, but often not. Once a day, one topic, next day, new topic, like cups of tea. And oh, this is something I forgot. Oh God, this is crazy, absolutely crazy. So he would tell me the meanings of the words from 3 dictionaries, and then he would look at a book he had. I'm not sure. Lopa will correct me if I'm wrong later on. He would go to the etymology of every word. The word etymology is something I learned from him. And he will go on and on like this. And sometimes he will land up, Ravi, this comes from Sanskrit. For him, everything in the world came from Sanskrit. And he will show some etymological relationship for every word with Sanskrit. But the whole concept then was, for this I'm saying for the Bachu Lok who might be listening, is to dig deeper. Do not take anything for granted. Keep on digging. And I don't have a slide to show it because I know it from memory. Now you'll hear it again when I talk about William Osler. And he said, we were talking to medical students. In those 1800s, there were no lady medical students. So he says like this, and the quote is like this: Gentlemen, I have a confession to make. Half of what we teach you will be in error. Furthermore, we cannot tell you which half. Furthermore, we can't tell you which half. So what you learn from your teachers may not always be right. And it's not their fault. It's just that they are also human beings. And this is another thing that I learned from Manu Kothari. Healthy disrespect for facts. And then you can look up 1,000 things where well-established rules of the game have been broken because somebody dug deeper. So, but you look, keep digging deeper, which means that trace everything to the root, whether it be some law, whether it be some fact. I'll give you homework for all of you, all but you look, okay? And this is how I talk in lectures. I'm starting with radiology. I'm ending up with how buildings become vertical. Something again that I learned from Manu Kothari. I mean, you go all over the place, and this is a homework for you because it teaches a point in medical research. How many billion neurons are there in a male brain and a female brain? If you care to dig deeper, you can send your response in whatever way you want by email to me, Ravi Ramakantan at gmail.com. It is TAN, not THAN. I hope at least one mail will come with an opinion. It need not be a right answer. You have to have an opinion. Okay, so this goes back to his obsession with word research, which again talks of his native intelligence and different way of looking at things. That's fine. That's as far as Manu Kothari and Ravi Ramakantan are concerned. I have Manu Kothari's and 100 other faculty is concerned. You have this issue now of how we are going to make this a reality of the medical profession. Okay, no, of the GS Medical College and KM Hospital. Catch them young, watch them grow is something that we keep saying in basketball training. Catch them young, watch them grow. So we have these Bachulo, first day, first show. Their parents and sometimes grandparents come, and the dean is addressing them. First day, first show. So there was a documentary being made for the KM Hospital by our benefactor, a lady called Gulsari Dasto, who spent lakhs of rupees, tens of lakhs of rupees of her money to make a 300-hour recording of all happenings in GSMC and KM, day and night, Sundays and holidays, Dahi Handi days, Diwali days. A camera with hand, professional camera, and This is a part of that event. So the dean was talking. There were students there, fathers and mother, grandfathers and some grandmothers. All this happened. And with camera in hand, I went to one of those bachus who was standing in the line to pay the fees. And I said, why have you decided to become a doctor? And then I soon realized that this boy could not speak English properly. So I said in Marathi, पाहिजे तर मराठीमध्ये बोल. And he said, me, some name he said, खेडेगाव, आमचा खेडेगावात डॉक्टर नाही, डिस्पेन्सरी नाही, आणि कोणी आजार पडला तर ट्रॅक्टरवर ठेवून आम्हाला बाजूला घेऊन जायला लागतो. मला डॉक्टर बनवून माझ्या गावेत जायचा. Now this was in 2000 whatever, right, long back, 8 or 9. I don't know if he has kept his promise of going back to his gaon and become a doctor. So these are the boys and girls who come with bright lights in their eyes. They have visions. They have thoughts. And it is first day, first show. 5.5 years later, this is what happens. They have a small convocation ceremony in which they read out the Hippocratic Oath, one candle in the hand and Hippocratic Oath in the other hand, and they say the Hippocratic Oath. They have become a doctor in front of their names. What happens in these 5.5 years is in our hands, totally, completely in the hands of the faculty of GS Medical College and KM Hospital. All of us know where we come from. We heard it yesterday from Dr. Pandit. And where we want to take these kids, I repeat, is totally, completely in our hands. We can morph them one way or the other. But the immediate job of those bachus on your left hand is this. Most of you GSI will recall this hall. This is the anatomy dissection hall. Nothing is there. This is where they would go and start dissection. And many of you are aware. They go into the dissection hall and you'll have third. 3 people have fallen unconscious. That's a common happening. So I took these pictures. I go to the GS Medical College off and on to take some lectures. And one morning I took these pictures and I told Rohan, no, what's his name, Rahul yesterday. Rahul, I want a picture of the anatomy hall, dissection hall with Bachu Log dissecting. This was yesterday morning. So he called back and said, sir, there are no dissections going on just now because new Bachus have not come. I said, okay, forget it. And half an hour later, Rahul being Rahul, I got this picture. This busy bee, I'm sure under the tutelage of Lopameta, had gone through our Silver Jubilee and Golden Jubilee souvenirs, annual report, whatever you want to call that, and taken out this picture from one of them. I think it's from the Silver Jubilee. So what happens now is this. First day, first show, someone talks to them in lecture number 2 or 3, and these bachus are thrown into the anatomy hall of dissection. Somebody talks to them again, and then they go to the different tables for head and neck, or head and face, whatever, upper lip, thorax, abdomen, and lower limbs. I closed my eyes for some time, and I said, from 1971, what do I remember of dissection? In those days, nobody told anything to us. I mean, we went there, we saw the body, and we started dissecting. We never thought something more than that. One thing that I know for sure is this, that the age of 18 or 19, in the first few days, this is what I realized, and I'm proud of them, is that once you cut through the skin and you look beyond the subcutaneous tissue, it's all the same beauty. It's the shining aponeurosis, the beautiful muscular planes, the bright red color of the heart, the 2 bellies of the superior oblique, the fascinating mechanism of the pulley of the superior object. It's all the same. And I said to myself, oh my God, it's true. Beauty is only skin deep. That's just a small part of what I'm coming to. I want all of you here listening to me, especially those who have been through dissection, to please close your eyes. When I say close your eyes, close your eyes. Because when you close your eyes, we can think back into the past. Who says so? I say so. So close your eyes. How many of you recall the face of those bodies that you dissect? How many of you even looked at the face of that body as a person? How many of you even thought about whose body that was? You may have been told that this is an unclaimed body. Maybe it is true. Maybe it is not true. More and more, there will be bodies of medical doctors, body of philanthropists, bodies of whoever who wills his body for dissection. You see, it's like this. In those days, and I think for a long time thereafter, this whole concept of respect for the dissecting body was maybe there in theory, but we were never told. We never had that. I'm told now that for the last few years, that's, that's changing. There are sessions when people are taught or when told about these concepts of how we have to have respect for whom we are dissecting, from whom we are learning. This is the foundation stone. This is the pile on which all of your learning of medical ethics, of medical philosophy, of medical humanities rests on. You learn as an 18-year-old kid that you respect something, someone whom you learn from. You have no idea who that was. All the same. So once this foundation is set, I'm very, very happy that this is happening in our institutions now, that the philosophy of dissection as dissecting apart, and this is what William Oscar said in a different way. Now, when what I said is that I looked at that body as upper limb, lower limb, abdomen, chest, hand, head, face, neck. I did not look at him as a human being. And so William Oscar has said, it's more important to know what sort of patient has the disease than what disease the patient has. More important to know what sort of patient has the disease than what disease the patient has. The same thing here. We are obsessed. I was obsessed. I don't know about others with dissection. I was so fond of dissection. I'd be in the hall with my partners, virtually every free time. But that obsession was with dissection. That obsession was not about the human thing that dissection is all about. I told you, it's changing for the better, and we should be grateful to all of those people in the Department of Anatomy that made it possible. You log are much luckier than what we were at that time. So this is where it all starts. Respect for a dead person. And then respect for a living person becomes automatic, or so we would think. Now, what happens is that you finish off dissection, you finish off your part exam, you finish off your card test in physiology, and then you go through that mug. Death is also a complication in pharmacology. The pathology slide, you look at the pathology like this, there is a corner broken, so this is mouth, esophagus, whatever. So you go through this, and then you land here. As Dr. Pandya said, you just have to cross one corridor and go to the hospital. That never happens. Lectures get over at 9 o'clock. Bachu log will walk to the canteen, aram se eat everything, and hopefully, I'm saying hopefully because I heard very disturbing reports of what happens to bachus after the lectures are over. Anyway, so hopefully you'll go to the wards, go to the OPDs, and this is what you see. I said these words in a previous lecture, but I don't mind repeating. Bachus, 18, 19-year-olds, are overwhelmed with human suffering. There are crowds and crowds of patients in the outpatients. There are crowds and crowds of patients in wards. There are wards, patients on beds. There are patients on in between beds. There are floor beds and there are corridor beds. This is what 18, 19, 20-year-olds have to go through with. It is a huge emotional burden to see this suffering in such a crowded situation. What happens to these children and how they handle once again is in the hand of our faculty. Sooner or later, बच्चे लोग learn this, that I have to do the dressing of this patient on bed number 40. They do that. Often they are told, वो 22 बेड में पेशेंट है ना, उसका ब्लड कलेक्ट करो, इसलिए बेड पे है ना, उसका एक्सरे रिपोर्ट लो. This is how patients are known. And if bed numbers change, God knows what will happen. As we go on in the training institutions, most of them, patients are known by their bed numbers, which means they become anonymous, like these bachus. Baby of this, baby of that, baby of this. And when you have anonymity as a means of communication between yourself and the patient, what do you expect? It's not the problem of the students. It's not their fault. It's how we train them. It's not sometimes our fault also, because the workloads are so heavy. But we have to have our priorities. When you are in charge of teaching, you're making a difference for generations to come. I'm not saying that this happens all the time. I mean, I'm not saying that every faculty does this. There are people who are extremely conscientious about these things, and bachus are taught the way they ought to be taught. But it's not always. And I hope that it will always be so. Therefore, the association between the patient and the human being is through bed numbers. And soon they become, oh, patient ka case paper leke aana. Everything happens on case paper. And what is worse, the days are coming when everything is happening on electronic medical records. We go into a room, there are computers and computers. You look at the record of Atmaram, these are his blood tests, these are his radiology tests, and you enter your treatment protocol on that. The patient is not seen. It's happening abroad, it's happening in some private hospitals in Bombay. It's not long before such a thing may happen in a hospital. Maybe that's far away. What's real here is that patients are getting to be known through their bed numbers and case records. Not always, but frequently enough to be disturbing. Therefore, this is what happens. These records then get transformed into patients. The patient becomes a case. It is inevitable, you would say. In a sense, it is inevitable. But that association between the human being, who is a doctor, and a human being, that is a patient, cannot be short circuited by case records. This is something that has to be imbibed by watching. I keep saying, watch and improve. That's another basketball term. You see your coach playing, you see your senior player, watch and improve. Most of medical education is about watch and learn. So the tragedy of anonymity could be human beings becoming case records. Now I will read these 4 lines to you, which I feel are extremely profound. You will not get into where they came from, how they came, but to me, these are important for every medical teacher, because every doctor by default is a medical teacher. Please read with me. No written word no spoken plea can teach our youth what they should be. No written word, no spoken plea can teach our youth what they should be. Or all the books on all the shelves. It's what their teachers are themselves. I cannot imagine anything that's more profound than this as far as medical education and training is concerned. I know of this for myself. I know of this for a host of other people who have trained as students in our hospital and maybe in postgraduate institute. It's all about mentoring. Therefore, all of this is in our hands. First day, first show, to the day that convocation happens, whether they call patients as case records or refer to patients as human beings, is in our hands. Excuse me. So let me go through this one more time because these are very favorite lines of me. No spoken word, no written plea can teach our youth what they should be, or all the books on all the shelves. It's what their teachers are themselves. When you are in a vacant or a pensive mood, think about these lines. It's what their teachers are themselves. Now, this is where MLK comes in. He taught beyond the subject. And medical humanities, patient care, personalized care is all about how much you know beyond the field of medicine. Therefore, I have done something new for the first time. These are 3 YouTube uh, resources that I want you to watch. How will you watch? You can scan this QR code with your cell phone. I'll give you 20 seconds and then you just do it like any QR code and it'll take you to the link. I'm doing this for the first time. 70-year-old, technologically savvy. I'm very proud of it. Anyway, I tried with, I have tested all of these QR codes, all of them work. The first one is from basketball coach Wooden, one of my heroes. He talks about, he was also a poetry teacher, but he is an all-time great basketball coach. Ken Robinson. You watch this video, you'll love it. Every great scientist, Carl Sagan, for example, talks of how schools kill creativity. That sort of goes on with what happens in medical college. Mug, MCQ, MCQ. So teachers have to make sure, like Dr. Manu Kothari did, that you read well beyond the subject. You have to read. Any donkey will pass MBBS. Any donkey will get through those need battlefields. Something will happen. But when you miss this opportunity when you are a resident or an undergraduate to read widely beyond, you miss the boat. Because when you become a physician, you may not have time in the early days to go through this. And the best one of all is a small poem by this little known poet called Glennis Harmon. And I want all faculty to read this poem. It's called Why I Teach. The first line is, they ask me why I teach, and I say, where else could you find such splendid company? Where else could you find such splendid company? So you read that poem, you feel inspired, really inspired to be a medical teacher or a teacher anywhere in the world. Okay, now let me illustrate all of this with one example, just one example, and then we are done. I promised 20 minutes. I know we're gone above that, but whatever. So this happened towards the end of 2009 or 10 when this documentary was going on, filming of the documentary was going on in KEM. We came across this lady who had dysphagia. So this female patient of 25, young lady, had dysphagia, and this is what we saw on the esophagogram. Okay, for those of you who are not oriented, the patient's front side is on your left, and you see the cervical spine there on your right. The top part of this image is barium in the pharynx, and then the lower part, the lower contrast filled part is in the esophagus. And then between the dilated or distended pharynx above you see a small jet. This jet is the jet of barium that flows through something called the esophageal web. This is classic example, undergraduate spot in an exam of an esophageal web. We don't see it often. In any case, this is a beautiful demonstration. There are so many other radiology points here. I'll not get into that, but this by all means is a classic example of an esophageal web. Now, radiology in KM is very, very intervention. So we wanted to do balloon dilatation of this 2008, 2009. So I talked to the chief of gastroenterology under whom this patient is admitted, and she is a very good friend, and we work together very well. So she said, okay, come Ravi, let's go and talk to the patient. So we go up to the 9th floor of the new building, and this is what happens. So this gastroenterologist starts talking to the patient. And this whole conversation is in a movie. I can't show you because I don't believe in movie on Zoom. It does all sorts of things. So this is on record, on high definition video and audio. So I don't want to tell her name. I don't have permission. So this gastroenterologist starts talking to the patient in Marathi. She explains to the patient that we will balloon dilate and you can go back home on the same day in the evening. तू त्या दिवशी घरी जाऊ शकते. And the patient starts crying. And that audio I have heard so many times. अगं तू कशाला रडते तू? And then the patient starts talking as the gastroenterologist wipes the tears of this patient. The patient says, I work in a construction firm. मी उद्या कामावर गेलो नाही तो मालिक माझा कामावरून काढणार. माझा घरी माझा पुरुष नाही, कोण नाही. मी कामावर गेलो नाही तर मला पैसे कुठून भेटेल. माझ्या मुलांना कुठून जेवण देऊ शकतो. म्हणून मला हे करून घ्यायचं नाही. हे आहे ते असू द्या. Suddenly, this interesting case of esophageal web has changed. And then it struck me again and again. It's something my original, I think, I'm sure I not plagiarized it from anywhere. And being in KM for so long, this truth dawns upon you again and again, that the only thing that is worse than poverty or ill health is poverty and ill health. That's what we see. That's what I've seen for 40 years. That's what our students will see again and again. The worst thing that can happen of poverty and ill health. If that is so, are we talking of case records? Are we talking of interesting cases like esophageal web, which will go and present an inter-hospital radiology meeting, or are we talking of something else? So this goes on for some time. And I suddenly realized that I have this slide with me of Robert Hutchison. Unfortunately, but you don't read this book any longer, but he says several important things. So those of you who are GS Medical College students, and those of you who are alumni who have not read this so far, enter the hospital through the Honorary entrance, the main hospital building. On your left side is this marble plaque. You should read it. Read every word of it. It's so true today. And the one important thing in that is what the subject of my talk is about. Treating patients as cases. It's nothing new that I'm talking about. Hutchison said it over 100 years ago. That is the tragedy of our times. If we as teachers do not lead our students down the right path, it's something that the Kothari has been talking about. You heard it right at the beginning of our talk. He was preaching it. He was talking about kindness and human spirit. And that is why there are situations where we have to resort to people like William Austin. I told you about what sort of patient has the disease rather than what disease the patient has. We are obsessed with pathology, not with the human being who has that pathology. Now look at this. Now I get emails off and on from people I know, people I don't know. Sir, what do you think? Sir, what do you think? And this is one of 50. Look at the top right. One of 50 of multiple mails, many more. I searched my emails for interesting case and see how many there are. People will send me cases. Sir, this is an interesting case of this. What do you think? Sir, this is an interesting case of this. What do you think? The concept of interesting case is universal. It may have been universal. It need not be so. If we are truthful to the memory of MLK, if we are a little thoughtful, if we are a little different, the whole word, the whole phrase, interesting cases can disappear. What's happening now is that we are moving away. You can watch any number of videos by Abraham Verghese. He talks of how we are moving away from clinical medicine. We have these toys now, functional MR, which shows us what's going on in our brain when we move our hand, whatever, but we are in the process losing the fine art of looking at the patient's mind and addressing his or her concern. We can look at the brain, but we can't look into the mind of the patient. Teachers, us, you, me, all of us have to change track if we have to and train our bachi log differently. Because this is all what medicine is about. The patient, not just the disease. Now, therefore, this case, which was presented, as I told you, in an inter-hospital radiology conference as this, look at the words that are being used. Interesting case of a 26-year-old female with dysphagia for solids and liquids since 6 months. Now, I want you to close your eyes again. All of you, please close your eyes. Imagine that you are all married. Imagine that you have children. Imagine then that someone asks you, Hare, how many kids do you have? What will you say? You'll say 2 boys, 1 girl, 2 boys. When was the last time any of you have said, I have 1 male child and 1 female child? You never say that. You have never said that. Still, when we talk of clinical histories, we say, this is a 7-year-old male child who came with abdominal pain. And we say this, 26-year-old female. To me, it's a big deal. I make a big deal of it. This is how you think of a patient as a female elephant, female cow, female what? These are human beings. They're not females. They are women or girl or whatever. So the way we think here changes into respect. That's what I believe. I firmly believe in that. Radiology residents train with me. You will never find them saying as females, male child or female child. It's a way to me of respecting the human that you are dealing with. Many of you may not agree, but I firmly believe that this is the beginning of changing how we look at patients without thinking about that. It becomes automatic, and that's how it has to be. So let's change this now. How does it sound? When you talk of this unfortunate patient who is a woman, who is just not a female, how would you like somebody to call after you and say, hey, female, you dropped your cell phone? How would you like that? Nobody likes that. It's inhuman to do that. It is disrespectful to do that. Therefore, this becomes a woman, and it can add some adjectives there. I mean, there's nothing wrong in saying that this is an unfortunate woman who has had these symptoms. Therefore, we need to break patterns. And if we at the GS Medical College do not do this with the burning enthusiasm of Bachu Log that we have, and the thoughtful faculty and their teachers have. Nobody is going to do that. We have simply got to change these patterns and create traditions and create new patterns. Therefore, there are no interesting cases. There are only unfortunate patients. And you see them all around you. Walk along the footpaths of outside the orthopedic center, outside the Tata Memorial Hospital. This is what you will see. You may have walked past these. Have you seen? You may have seen, but not registered. Look at the faces of these patients. What do you see? Do you see hope? Do you see despair? Can we change that despair into hope? Can we change that hope into reality? Therefore, these are topics I feel that all of us, especially the older ones amongst us, should be thinking of. The science of medicine will always be there. There will always be interesting cases, but I will leave with this poignant image of an unfortunate patient to remind you that there are no interesting cases, only unfortunate patients. I'm done. Thank you. Good night.
Wonderful talk, Ravi. Wonderful talk. Thank you.
Thank you. Okay, normally when I give a talk like this, even when I give a radiology talk, there are no questions. I tell people don't ask questions because I will not have an answer to the question that you have. So unless there's something really, really important, I think we'll close off today. It's a Sunday evening. It took longer than I thought. Therefore, I'll leave it to the moderator to decide what to do. I hear nothing.
Sir, actually, I'm supposed to be giving a vote of thanks.
Yeah, good. I like that.
Ravi, yes,
Yeah.
here. Just one line.
Yeah, Yash.
Sunday evening were very, very well spent.
Oh, thanks, Yash. Coming from you, it's really nice. Yash, you're not a whole lot of hair. What is going on?
At least there's some remaining.
Yeah.
Ravi,
Yash,
Ravi,
you should visit to get your gang and come to KM one day, no? I mean it really, yeah. It will make a whole difference to Shetty if nobody else, yeah.
Yeah. Actually, I am attached to Science for the last 10 years.
Oh, good. Okay.
I'm very much in touch with the municipal hospitals. Yeah.
Okay, fine.
Ravi, this talk reminds me of Tagore. It says, Aguner Parashmani Chhuao Prane. So it's MLK was a touchstone which turned people into gold. And I think you are doing something similar. I think that holds true for a lot many people. That includes Yash too.
Yeah, thank you. Where is a vote of thanks?
Sir, actually, it has made us as teachers realize what responsibility lies on our shoulders. Now, it is very easy for us to blame the current assessment system or educational system and then justify what happens. But I do not know the solution for this problem. But in each of us in our own way, I'm sure we can take inspiration from this talk and make a small difference. Inspiration from Dr. Manu Kothari and Dr. Sunil Pandey and Dr. Lupa Mehta, and make a small difference in our own way, so that those many various disciplines, if the students learn differently, I'm sure it is going to bring up a different generation of doctors. So I thank you from the bottom of my heart, sir, and I really wish that this message has gone to all the teachers. And why only older? It should be with all teachers, I think, all generations. That's is what I really wish. I thank our Dean, Dr. Sangeeta Rawat, for being a source of inspiration for us and a constant support. Without Dr. Sunil Pandya and Dr. Lopa Mehta, medical humanities would not be what it is today. They have been constantly guiding us over last so many years. And definitely, as you said, the undergraduates who run the whole show, and you said Gadha Majuri, but it is in many ways, it is like a Gadha Majuri, but I'm sure it is labor of their love, and they all do it very willingly and very happily. And I am thankful to Rucha, Radhika, Rahul, all of them. I do not even know everybody's names, but I'm really thankful to them. And last but not the least, I'm thankful to all the audiences who make these programs possible. Thank you all very much and have a very good night.
Good night.
Another plaque.
Sorry.
Yes, yes. Rucha.
What happened?
My PowerPoint is not coming up. I'm sure. Sorry.
Don't tell me I have to watch your program now.
No, not at all. Rucha, you. Please bear with me.
I'll call you back.
We offer this plaque of this of symbol of our affection and gratitude to Dr. Ravi Ramakantan this evening.
Thank you.
Thank you very much. So thank you all.
Okay, I'm leaving now, may I?
Yes, sir. Thank you. Thank you.
Thank you. Good night, everyone.
Thanks a lot. Good night.